We'll discuss some general tips for new parents. So, generally, parents are worried about how to feed, and my baby is always sleeping, and how many times baby should pass urine and stool and things like that. So, so feeding. So, as you all know, best feeding is that feeding with always best feeding for the baby. So try to give exclusively, that is only breastfeed for first 6 months of life for the baby, and after completion of 6 months you can start introducing some semi-solid foods known as starting complementary feed. So how many times you have to give the feed? So generally in the first starting days we say till the bonding happens you can feed every 2 to 3 hourly, but it's entirely depend on the requirement of the baby. So it's called on demand feed. That's whenever baby demands for the feeding, you give the baby feed. No time restriction. It may be 1 hourly, it may be half an hourly, and sometimes baby may sleep for 3 hourly and then take the breastfeed. So give the feed for the baby on demand, and for how long you have to feed. So once you put on one side of the breast, try to feed try to get that breast entirely empty till the time you have to feed. Usually for around 15 minutes to 20 minutes you have to feed for on one side of the breast, and if it is once it's empty you have to shift to the other side of the breast. And usually babies are more active and more awake in the night time, and they sleep more in the daytime for initial 2 to 3 months. So this is entirely normal, and no need to worry. And usually they will, as they are more awake in the night, they may cry more and take the feed more. So this is entirely normal, 2 to 3 months, and they will start adapting and adjusting to waking up in the day and sleeping more in the night, usually by 2.5 to 3 months. So, and usually babies sleep for around 16 to 18 hours in a day. So once baby take the feeding, usually he will goes to sleep for 1.5 hour, and that shows that baby is taking the breastfeed well. And how many times baby should pass urine and stool? Usually baby should pass urine within first 48 hours, and stool should be passed within 24 hours for the first time. After that, by around day 3 or day 4, baby will pass around minimum of 6 to 8 times in 24 hours, and but stool baby can pass around 6 to 8 times in a day, or one stool in 3 to 4 days. Both are normal. That is, if baby passes around 6 to 8 times in a day, that's also normal. Or baby passes stool once in 4 days or 5 days, that's also entirely normal. And usually in first 3-4 months, baby passes stool immediately after the feeding. Many parents are worried that baby is not gaining weight, and as soon as he feeds, baby is passing, so he is not absorbing anything. There is nothing like that. And there is something called gastrocolic reflex, which makes the baby pass stool immediately after feeding. That is more active in the initial days. So initial 1 or 2 months, it's more active. So it's no problem with that. And how to keep baby warm? So you should know that baby should be warm both in the center, and that is body also should be warm, and his hands, feet also should be warm. And major surface, that is a major part of the baby, is his head. His head should be put a cap and keep the baby warm, but it should not be so excess that baby is becoming so warm, even in like what happens in warm temperature also. If you are putting the sweater, cap and socks, everything, baby may become more warm, and you may feel like baby is having fever. And sometimes it may also lead to dehydration, leading to dehydration fever. So recommendation is keep the baby warm and comfortable, based on the external temperature. If it's cold, you put the baby's adequate clothing like cap, till the cord is fallen off and its stump is dried because of chances of infection of the umbilical cord. Till that time, you can clean the baby with the cloth which is soaked in the warm water, and as far as possible, try to avoid the powders for the baby and any kajuls for the baby. So, and if you want to use minimally.